Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina Callion, the #1 NCLEX instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass NCLEX. Welcome to Monday Motivation / Let's Talk NCLEX. Monday Motivation / Let's Talk NCLEX. You are in the place to be if you are studying for your state board exam. If you're in nursing, you graduated from nursing school, or even if you're still in nursing school and you're just ready to tackle the biggest exam of your nursing career. Welcome. This is Remar Review. You're going to love this episode. We are giving you the Monday motivation that you require, plus. We're going to do some NCLEX questions that will snap you right into position to study. If it's your first time, we like to call this Let's Talk NCLEX / Monday Motivation, or vice versa. You can get inspiration, encouragement, empowerment, mentorship. Oh my goodness. The motivation, though, is key. If this is your first time here, I like to welcome you formally. I'm Regina Callion. I have a master's in the science of nursing education, as well as a registered nursing license. But I am most proud to tell you that I am the #1 NCLEX instructor on this planet. And I love doing what I do here at Remar Review. Remar Review is such a unique company because we literally have a mind for you to succeed. It is just not about the products. You know how sometimes you can have an experience with a company and it's literally, okay, after they sell you a product, you never hear from them again. Nobody ever reaches out. You never see the person. And I know, look, I'm speaking the truth. There are some NCLEX review companies that you have in your home right now. You have the books in your home right now, and you have no idea who the people are. You look at the cover, you don't know the people, you never see them. So we strive to be so different. We want you to know who we are. We want you to feel like during your journey of passing NCLEX, you are supported. And it's a very unique community. It's in a very unique family here. I dare to say family. But one of the great things about our weekly meetings is it gives you an opportunity to dialogue with other people in your same situation so you don't feel alone. Oh, it is lonely at the top. And you guys are going to be at the top once you get to your final destination. And we're going to make sure that you get there. And so we're really excited today. Our topic for today is who wins? Who wins? Hey, but you know what? I need to tell you guys that, we finished our last Winning Wednesday where we were going over the 5-star quick facts. That's done. But it was so good that I thought to myself, how must I continue this opportunity to meet with you guys again during the week? And so we're going to keep the ball rolling. Guess what, guys? We are going to do Winning Wednesdays again. And we're going to do it. Look at our next session. Check it out. Our next session is August 7th. And we're going to do it again August the 14th. 9 a.m. from the Remar Nurse Facebook study group. You got to get in that group because great things are happening. This is not just a regular group. This is not just a regular company. We come together and we study. We're going to be studying, check it out, the NCLEX DVD workbook. That's right. We are taking it to the full program. I want to make sure you know it. So remember, let me say this because some of you are like, well, guess what? I don't have the full program. One of the things particularly about our Facebook study group is it is for people who have the Remar products. I know that if I tell you guys, okay, go ahead and just go off on your own, do the 6-week challenge, and I'll see you in 6 weeks, au revoir. Like, I know if I do that, it's going to be very difficult for you guys to actually get through the material alone. So the Facebook study group is reserved for those who have the Remar product. So I'm hoping that everybody, because this is what I'll be going over right here. I'm hoping that everybody in this book, in the Remar group, you have this book. And so I will be going over sections of the DVD workbook so that at the same time, you can get out your workbook and you can say, okay, Regina, I'm right here with you. I've done that section. And I'm not even sure exactly which ones I'm going to go over first. But, for example, if I do orthopedics, like if I'm going over orthopedics, you've already watched the DVD. So I'm going to come at you from this book. But you know what it's like when you're studying with me. You guys already know I'm going to take you up a notch, right? So I'm going to make sure that not only do you know the information in the DVD program, but that you're applying it and you know what I'm talking about. So I'm really excited for the next Winning Wednesdays. Again, that is going to be August the 7th and August the 14th at 9 a.m. And we're going to be studying the student DVD workbook. And listen to this. If you by chance, by some strange happening, you don't have the program, let me give you a code. It's Remar. Let me give you the Remar code. If you go to remarnurse.com, again, that is remarnurse.com, and purchase the DVD self-study program, put in that code, it will drop that price down for you, and you are able to get the program. And I'm telling you this now because some of you guys, you don't have the program. And if you get the program now, if you get the program today, by the time our Winning Wednesdays pop up, you will be able to study along with me and your other peers during those times. And those study sessions are usually, number one, they're free, totally free tutoring on the program. And they last about an hour. So not only will you have Monday motivation, not only can you get access to the boot camp, which we give to everybody in who has a Remar product, right? Who has that program. You'll get the boot camp. You'll get Monday motivations you can do. You can now do Winning Wednesdays as well. We want to make sure that you get your license. That's what this whole thing is about. So website, remarnurse.com. If you have any questions about the resources, what I do, where we have come from, hey, that's your place to go, remarnurse.com. Again, we have a lot of nurses that are passing every day. Don't forget, you are the reward. Tell us your story. We love those videos. Every video that we receive, the student gets a Remar Nurse official Remar Nurse t-shirt. I love seeing pictures with nurses in those shirts. All you got to do is pass. All you got to do, and you get your Remar merch. And it is an amazing opportunity for you to tell your testimony, because I'm telling you, like, I rock Remar all the time. Me, myself, Mark, the staff wear it every day. My mom has it on. And I'm telling you, every time I'm out or something, people will be like, what's a Remar nurse? And I'll say, what's a Remar nurse? And it's my opportunity to give my testimony. Honey, I've been through all this stuff, but look what the Lord has done. Like, it's a perfect opportunity to explain in your own words, what is a Remar nurse? We are a community. We are a community that is so powerful, and we give back to each other. We give back, we uplift, we support. Speaking of giving back, you guys remember 2019 was our year of giving. Not even was, because it's still 2019, but we are actually giving away a cruise for two. Yes, a cruise for two to one very, 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 very worthy, deserving nurse who studied with Remar. This is how you enter the cruise. Some of you may not know. You've studied with Remar. You've passed your NCLEX exam. And you did a video saying, hey, I passed with Remar. This was my story. This is how I did it. I know you can do it as well. That's it. We get those all the time anyways. So all we're saying is that if you have done that in 2019, or you pass your NCLEX and you do it now, you'll be entered into a drawing and you will win a free cruise. And not only yourself, but anybody of your choosing will also have their fare, their airfare, their cruise fare will be along for the ride too. Isn't it great when you can get blessed and then other people get blessed because you get blessed? I love that. And so that's what we're doing. Not only that, we will not only fly you down, we'll send you on a cruise. We're also going to give you not one, not two, not three, not four, but $500 to spend during that cruise time. So will it be you? Will it be you? We shall see. Our Monday motivation topic. Oh, it's a good one. You know what? But it's very old school. Like some of you guys may know this if you have your own businesses or if you've just been around business people. They like to say this a lot. They'll ask, who wins? Who wins? That's the Monday motivation topic. And the idea of who wins, normally, you know what it is? Old school business, old school classic is the person with the most knowledge wins, period, right? That's the setup in the world. If you know more, if you have more than another person, you automatically win, okay? Whatever the transaction is. So I thought about this to myself, because you guys know that I get these motivations from my own personal life or things that I encounter. And so I was at a business meeting for Remar, and this idea came up, like, well, who knows the most? Because if you know the most, then you have the experience, the knowledge, the upper hand over the other person. And it was very interesting because I thought, well, does this principle apply in NCLEX? Is it a matter of who has the most knowledge? Like, I think there is this idea that this idea of whoever has the most knowledge wins, whoever has the most knowledge pass. Whatever company that can give you, the most information, the most facts wins. Like, so this is what I'm typically saying. Okay. Like, so business win principle, business win recipe, especially for NCLEX, it's like, okay, who has the most facts, right? Who can present the most concepts, or who can, give the fastest answers in business? Who's the first person to speak, or, who has the most resources? Like, I don't even have it with me, but you guys know, like, okay, so demonstration and demonstration, like, so these are just the Remar products that I have, right? These are the Remar products that I have, and most of my workbooks, you guys know, are very, what should I say? They are very petite, right? Not a lot to them. But you guys know the NCLEX books. You guys have NCLEX books that are like this thick, like all together. And this is just like one topic, right? This is like one topic. This is, I won't say the name, but this is just your pediatrics notes for NCLEX, right? Just pediatrics or just cardiology. And so it's this idea that if we give students the most, if we say, here, you need to know all of this on one subject, then like, okay, this is the company that wins. Like, this is the company that the school wants to bring in. This is the company that, people are saying, go here and spend your money because they're giving you the most stuff, like the most information. Here. They don't even tell you like how to study it. They just say, here. They're like serving it up. So it's like, okay, the company with the most in a way that is overwhelming. Dare I say all of that information is overwhelming? I don't know. I thought like, okay, how can this apply and motivate nursing students? And I wanted to just bring it back in with this thought. Like, this is the NCLEX twist for me. Like, don't confuse knowledge with understanding. It is so different. It is so different for me to listen to a teacher that just knows a whole bunch of facts. Like, you know what I mean? Like, or it is so different for me to sit in a lecture and the lecture is 1 hour and literally the person is just reading to me from a PowerPoint presentation, like reading facts. I mean, the things that they're reading is all knowledge, but there is no process of understanding. There is no connection. There is no theory to guide me through the curriculum. And that's what I see. And I wish I had like one of those books, but that's what I see when I see resources that are this big. It's like, here is the subject that I want the nursing students to know. But when you open up a book, there is no kind of path to understanding. It is literally just a book of knowledge. And so students, you guys, because you have such good hearts and because you really want to try hard, you take up the task of memorizing these facts. You try to absorb all of this knowledge. And what happens is you have very little understanding. So for example, I can ask you, what is the normal potassium level? Most nursing students, when I teach a class, I can ask them, hey, what is diabetes insipidus? Or sometimes I can't even ask them that because they don't know. But I could ask them, what is diabetes mellitus? Like most nursing students will know diabetes mellitus. But if I ask them to, anticipate complications of a patient with congestive heart failure and renal disease, like what kind of connection is there to congestive heart failure and renal disease? Or, what do we have to be mindful of when we have a client who has low platelets, or, and then they're getting a blood transfusion or they're getting surgery? Like, there are some topics on your NCLEX exam, and you guys who are repeat test takers, there are some topics on your NCLEX exam that go beyond knowledge and they're straight into understanding. And this is where students really struggle. So I have to spend a lot of my time not only going over the knowledge. I do go over the knowledge part because there are just certain facts you have to know, but I'm really trying to guide you guys through the process to an understanding level because it's different. And so when we talk about knowledge, so most nursing students, they have this reference of information. There is a certain awareness to what needs to be memorized. But the understanding is really being able to take that knowledge and put it in a constructed context. And that is where NCLEX gets the better of a lot of us, because they'll take that knowledge that you have and they'll put it in a context that you haven't seen before. And they'll put it in a constructed concept that requires you to be able to apply that knowledge in a different reference. And so you're not just looking at abnormal laboratory values, but now you're considering, okay, the patient may have abnormal laboratory values, but is there a greater priority than this, And so that's the challenge. And that's the beauty of having a true understanding of the nursing process, right? And so we just want to make sure that for this week, we're not just memorizing random facts, right? We haven't taken up our mantle in the wrong way. So this is something I like to say. Sometimes I see students and they're studying and they're learning, but they're learning to fail. They're learning to fail. And that's a powerful concept. I might do a motivation on that, learning to fail, but that's essentially what is happening. All of the studying that they do, all the information, when you're studying with the wrong product or with a system that does not make the best of your learning style, that is what you're doing. You're learning to fail. So in the end, I want to say, not the person with the most knowledge, but the person with the most understanding wins. The person that is able to see past the basic facts and can apply information to future events, that is the person who wins. Thank you guys for Monday Motivation. Thank you for that. I just want to thank you because you went with me on that journey mentally and we arrived at this place. And this place is, let's talk NCLEX. So we're going to get into our NCLEX, but keep that in mind. I mean, as I transition, that was kind of an abrupt transition. I had no smoothness to that. But as we transition, remember, we are looking for understanding today. There it is. There's my transition. And as we are on the journey to understanding, let us start with these NCLEX questions. So I have 5 questions for you today. I have 5 questions for you today. And shout out to the question bank book, because today's questions are from the question bank book. Remember our share goal, sharing is caring. So there's a challenge. I want a showdown. There's a showdown at the OK Corral between Facebook and YouTube. I'm trying to get 100 Facebook shares. And or if you're on YouTube, I'm trying to get 100 big thumbs up. Smash that share button. Smash that big thumbs up button. Let's see who wins today. And I will plan to do something special for either Facebook or YouTube, depending on the winners. And I'll announce the winner next Motivational Monday. So let's go, people. Facebook, I know we can get 100 shares. We have done it already several times over. And actually, my last Monday motivation, YouTube, you got 200 shares. No, you got 200 big thumbs up. So I know you can get 100. I mean, this is just a baseline. I'm just trying to see who's more active, who's more about it, Facebook or YouTube. Question number 1, a charge nurse is managing a group of hospital staff. Which of the following actions indicate a need for further instruction? All right, so we're looking at the staff members today. A charge nurse is managing a group of hospital staff. Which of the following actions indicate a need for further instructions? Is it number 1, a registered nurse who pronounces a client dead? 2, a nurse's aide who takes an apical pulse on a client with congestive heart failure? 3, a nurse's aide who is reporting malfunctioning equipment? And or 4, no, it's just and 4, a licensed practical nurse who has documented follow-up teaching in a client's chart. So again, we're looking for the staff member who is going to need a little reorientation. Is it number 1, the registered nurse who pronounces a client dead? 2, a nurse's aide who has taken an apical pulse on a client with congestive heart failure? 3, a nurse's aide who is reporting malfunctioning equipment? Or 4, a licensed practical nurse who has documented follow-up teaching in a client's chart? What sayeth you? The answers are rolling in. I'm rolling in the answers. Facebook, YouTube, what do you think? We're looking for the one that's inappropriate. I see 1s, I see 3s, I see 2s, I see 4s. Can that practical nurse do teaching? What do you guys think? Can a registered nurse pronounce a client dead? Is that within the scope of practice? Oh, who is in the wrong here? This staff, you got to know it. And this is why it's so important. Just as an interlude, this is why it's so important for PNs and RNs to come together at times, I think, and do these questions, because you need to know what is the scope of practice. And I said this on the last Monday motivation. You need to know what is the scope of practice of the interdisciplinary team. Interdisciplinary team is huge on NCLEX, and it's a subject that I go over multiple times. Also, if you have the question bank book, you guys know the interdisciplinary questions in here, but you got to know what is the responsibility of the other members of the team. So here, check this out. The correct answer of the staff member who is in the wrong is actually going to be, this may surprise you, but 2, the nurse's aide who takes an apical pulse on a client with congestive heart failure. You cannot do that. No, the nurse's aide, you don't have the skills to know that you're listening to the apical pulse. You don't have the assessment skills to be able to find it. It's not something that you were trained to do. So check this out. If you guys thought it was the registered nurse pronouncing it dead, let me just read this here. So pronouncement of death is legal by a registered nurse. Pronouncement and certification, they're not the same thing, all right? So a registered nurse, because we have been trained in the interpretation of vital signs, and objective data, the registered nurse can say, this client has no activities of life. There is no pulse, there is no blood pressure, there are no respirations. This client is dead. Okay, so registered nurses can pronounce death. They will write it down. Hospice nurses do it all the time. Then the healthcare provider, aka the doctor, will come in, certify that the client is dead. Or what is the word I'm looking for? The coroner can also do it. I mean, if they send a body to the coroner and then you wait for the coroner to pronounce the person dead, that's a very long time, and that's very unusual. Before the coroner gets a body, somebody should have pronounced that person to be dead, because you just don't want to end up in the coroner's desk office. I'm getting off track, but that is what I'm trying to say. I'm trying to say that it is the registered nurse's responsibility to say, hey, this client no longer has vital signs. All right. That got creepy. All right. So here we go. The LPN is legally responsible for documenting follow-up education. Don't forget that the LPNs can do teaching. They do reinforcement teaching. They do follow-up education, all part of their scope of practice. So that's okay. And it's a common misconception that LPNs don't teach, but they do. Hey, did you guys know we had an Instagram page? This question actually comes from the REMAR for NCLEX REMAR Review Instagram page, and you're going to love it. I think it'll be easy, but you let me know. Here we go. What is the most likely diagnosis in this patient with hypothermia and bradycardia? Looking at this patient who has hypothermia and bradycardia, is it number 1, Cushing's syndrome, 2, generalized lipodystrophy, 3, hypothyroidism, or 4, superior vena cava syndrome? Oh, what does this patient look like to you? Don't you love images? If you know the pathophysiology behind something, that image will strike out to you and you will say, oh, I know 100% for sure this is superior vena cava syndrome, or whatever it is. I'm just asking, what do you guys think this is? I see the answers coming in. Facebook, lots of threes, few ones. YouTube, great job. Come on in. This is done. Listen, if you're just joining us, we're deep into this program. This is Let's Talk NCLEX. We're trying to figure out what is going on with this patient. Is this a Cushing's patient? I mean, I'm looking at the hair. What is going on? This patient, hypothermia, bradycardia. We're deep into NCLEX. I love it. I'm loving it. The answer to this question, ladies and gentlemen, go ahead, put your answers down and just commit. Don't be shy around here. Go ahead and put your answer. The answer to this question is, oh, yes, this patient has hypothyroidism. Yes. The edema of the face, coarse skin, and thin hair in a patient with bradycardia and hypothermia are common signs of severe hypothyroidism. You guys know patients with hypothyroidism have that intolerance to cold. They're always cold. They like blankets put on them. Yes, this patient has a very, very severe case, but the patient can recover fully, have a normal life if that thyroid hormone is in place and is at a normal level. And I'm just looking here because I wanted to see if maybe I would go over hypothyroidism. Where is it at in this book? This is the student workbook that I'll be going over when I do Winning Wednesdays. And so endocrine review, I do diabetes, but then I like this because what I do is I go the difference between hyperthyroidism and hypothyroidism and the treatments. So I may very well just do that topic for Winning Wednesdays. But we see. All right. So did you get that one right? Classic signs, hypothyroidism. Let's move on. This is question number 3. Oh, I like this one too. Critical thinking. Here we go. Which group of clients needs special monitoring by the nurse while receiving furosemide therapy? Which group of clients needs special monitoring by the nurse while receiving furosemide therapy? Number 1, group with multiple sclerosis. So client with multiple sclerosis. 2, clients with diabetes mellitus. 3, clients with stage 3 wound ulcers. Or 4, clients with increased leukocytes. What do you say here? I like this. I like this topic a lot. I think it's very, very important for you. Sometimes you guys will see themes during Monday Motivation, Let's Talk NCLEX. And I just want you to know there are themes for a reason. I'm trying to get you guys to pass your NCLEX. I really want you to know these specific safety points here. Go ahead, put your answer on the screen. This is it. This is us getting into Let's Talk NCLEX. And I thank you guys for participating. Facebook, YouTube, there's a showdown. We're looking for 100 shares on Facebook and or 100 thumbs up on the video, not in the comments, guys. You got to put it on YouTube. You got to put it on the video. Give this video a big thumbs up, not in the comments. It's a showdown, and I'm going to have something special for the winners on Facebook or YouTube. All right, so the answers are coming in. Yes, number 2 was actually the correct answer here. And I know you guys knew this. I know you guys remembered that this was an important point, because when you're talking about diabetes mellitus and furosemide together, that diuretic may increase blood glucose levels. And I have literally been talking about this ad nauseum. This is like, if you're a faithful Monday Motivation person, you guys know, like, this is the 3rd time I'm trying to drive home this point. It's major, major, major. Question number 4. Question number 4 coming at you guys. Feel good type of question right here. A 32-year-old male involved in a multiple trauma car accident is admitted to the emergency unit. Which assessment finding signals the most serious and life-threatening condition? Is it number 1, a deviated trachea? 2, a blood glucose level of 200? 3, decreased bowel sounds? Or 4, hematuria? All right, and I just want you to think about what is the issue or the cause of each one of these. If a client in a multiple trauma car accident has hematuria, that means there's some internal damage going on, right? That means there's blood getting in the urine. Perhaps some internal organs have been damaged. Definitely there could be some bleeding in the bladder. There's something going on with that patient. So I want you to look at every one of these and consider the most dangerous, the most significant of these clinical symptoms. And it's something that will really help you with your prioritization questions in general. And it'll be very, very useful. So I see the answers coming in, and I'm loving you guys' participation. It is great today. It is fantastic on Facebook and in YouTube. Let me tell you the correct answer. You guys probably knew this because it's an airway here, but the deviated trachea is a classic sign of tension pneumothorax. Yes, this is another condition that we go over during the review. And with tension pneumothorax, actually, the deviated trachea is something that you can see externally. So it's a big important factor for NCLEX, because you as the nurse have to be able to recognize that when a person has a deviated trachea, that means that, hey, even though you see the trachea deviated to the right or the left, the real issue is not the trachea. The real issue is coming from the thorax. There is something happening where air is coming into the patient, but it's not able to escape. So normally that's some trauma that has taken place. Like I don't, their patient has been stabbed, they've been in a car accident, and now they have, a wound in their chest where air is getting into the patient. Air is flowing in, but there's no way for it to come out. So that accumulation of air literally shifts everything over because breathing, we have a negative pressure system. So normally the lungs are deflated, right? There's nothing going on. And then the lungs, they expand to allow air, that positive pressure to come in, and then they deflate again. So the body is accommodating all of this air that's coming in by shifting everything over. So the trachea, everything will shift over. But the idea is that if your patient is experiencing a tension pneumothorax, they're going to die soon. That's the prognosis for this patient if something is not done. So you have to be able to recognize that as a priority, a deviated trachea as a priority over anything else. Okay. So last question, are we at our goals? Have we run the good race? Have we done what we needed to do? Check it out. You guys. You guys, you did it. I am happy. I am excited. You guys did it. You did it. Thumbs up. Listen. Okay. Last question, guys. Last question. Here it is. All right. Which client should the medication morphine IV be administered to with caution? Number 1, the client with uncontrolled type 2 diabetes. 2, the client who is addicted to opioids. 3, the client with emphysema. 4, the client 18 hours post-operative with a hip replacement. Now, this is a tough one. I don't know. Listen, this is a tough one. Here it is. Which client should the medication morphine IV be administered to with caution? 1, the client with uncontrolled type 2 diabetes. 2, the client who is addicted to opioids. 3, the client with emphysema. 4, the client 18 hours post-operative with a hip replacement. Now, this is a challenging one. Listen, you have a lot of things going on here. We know that morphine is, we know it's a pain medicine, okay? We know it has certain properties to it. We know it can be addictive. We know, what do we know about it? Listen, there's a lot going on here. So out of all of these patients, who are you most concerned about? Yes, who are you most concerned about giving this morphine to? And I want you to think safety. Because you know what? This whole NCLEX exam is based off of patient safety. So you have to think, okay, what is the safest thing for me to do as the nurse? And it is not easy. It is not easy to anticipate this type of scenario, especially if you're new. So, hey, if this is your first time studying with us here at Let's Talk NCLEX, I'm glad you're here, whether you get this question right or wrong. And I'm just going to give you guys the answer right now. If I was the nurse and I had to give morphine IV, I would be very, very, very cautious to give it to the client the client with emphysema, because they have a respiratory condition. They already are not getting that gas exchange perfused appropriately. So if I give them morphine, what is that morphine going to do to my patient with emphysema? What is it going to do? It is going to depress their respirations, right? I have to monitor that not only will they possibly be breathing less, but I already know the gas exchange is poor. So I'm worried about this patient. I am worried because airway comes before anything, right? Airway comes before anything. The person with uncontrolled type 2 diabetes, okay, I'm going to give this person morphine. It's going to address pain, especially if they have some sort of painful something. I want to say ulcers, but then they might have peripheral neuropathy. They might not even feel it. But if they have another condition for acute pain, I will freely give them morphine. The client who is addicted to opioids, what do you think the morphine is going to do to that patient? This patient already has an addiction. The morphine, and just being honest with you guys, the morphine you give them may not even work. Okay? Patients who have a high tolerance for opioids, and they're using them regularly multiple times a day, when they come to the hospital and we give them 1 milligram of morphine or 2 milligrams of morphine, they just look at us sometimes like, this is not helping the pain. I do these drugs regularly. And so there's always a conflict there of, okay, how much can I give you for pain? And then how much am I giving you for pleasure? So this is the consideration here. The client with emphysema, we explained that. For the client 18 hours post-operative with a hip replacement, this patient will be able to have the morphine. You don't have as much of a worry as anesthesia, being on board with the patient, because there's a long duration between the time of surgery here, almost a day now. So the respiratory patient is really going to be the priority here. All right. So, hey, did you guys enjoy Monday Motivation Let's Talk NCLEX? I did. Kept us under an hour. Met our goal for this week. Thank you guys so much for coming. I want to remind you, it's not over. It's not over. This week is full of possibilities to gain that understanding. We have Winning Wednesday. We have Winning Wednesdays coming up. Prepare for it. Get into your program. Like, if you've lost connection with your DVD program, reunite the passion. All right. And get into it so that during Winning Wednesdays, you can feel more confident and you can go over the information with me here at Remar. Also, I really can't tell you guys this enough, but when you're looking to contact us, we are here to help you with your NCLEX needs. So message me if you have a question about a product, if you don't know what product to buy, if you're studying with one of our products and you see something, that is the time to message me. All right. Because we get a ton of messages and we really prioritize the Remar nurses over anybody else. And I'm just going to say that very freely. Like, we love our Remar nurses. So support@remarreview.com is where you can reach out to get your questions answered. All right. And then also, we always end saying the most positively affirming words that we can about this NCLEX process. And I think this is one of the most important things that we do together. We say what we believe. We say what we believe, which is, we can, we will, we must pass NCLEX. Hey, that's the anthem from the podcast. It goes a little bit something like this. We can, we will, we must pass NCLEX. So I want to say that to you guys. I want to say